Hello and welcome to this presentation lecture about oral pathology. The oral pathology comprises different types of inflammation, infection and neoplasm. Now let's begin with grouping of different types of oral pathology. Inflammatory or reactive tumor-like lesions comprise fibrous proliferative lesions in which irritation fibroma, pyogenic granuloma, peripheral giant cell granuloma, and second type aphthous ulcers also called canker sores and glossitis. In infections, HSV infection, oral viral infections, oral candidiasis which is also fungal disease, deep fungal infections, oral manifestation of systemic disease. Hairy leukoplakia, it occurs in immunocompromised patient, tumors and precancerous lesions. Leukoplakia and erythroplakia, squamous cell carcinoma belongs in tumor and precancerous lesions. The pathology of teeth and supporting structures, it comprises caries, also called tooth decay, gingivitis, periodontitis. Now let's begin with premalignant lesions. Some past questions: write short notes on erythroplakia and also leukoplakia. Introduction of premalignant lesions. There are three types: leukoplakia, erythroplakia, speckled leukoerythroplakia. Now leukoplakia, look at the picture, you can see white patches arising ventral of the tongue. A white patch or plaque that cannot be scraped off and cannot be characterized clinically, pathologically as any other diseases. If a white lesions in oral cavity can be given a specific diagnosis, it is not leukoplakia. So, white patches caused by entities such as lichen planus and candidiasis are not leukoplakia, they are infections. These white patches caused by entities such as lichen planus and candidiasis are infectious lesions, and this leukoplakia is characterized by it cannot be scraped off and cannot be characterized clinically, pathologically as any other diseases. Its etiopathogenesis, etiology is unknown, may be multifactional origin, may be tobacco use, most common etiology cigarette, pipes, cigars and chewing of tobacco. Other precancerous lesions: iron deficiency, oral submucosal fibrosis, syphilis, xeroderma pigmentosa and lupus erythematosus. Alcohol, spicy food, jagged teeth, ill-fitting dentures. This lupus erythematosus is type 3 hypersensitivity reactions. Morphology: site, buccal mucosa, floor of mouth, ventral surface of tongue, palate and gingival or anywhere in oral cavity. Gross morphology: solitary or multiple white patches or flakes. Sharply demarcated borders. Look at here, you can see sharply demarcated borders. Lightly thickened, wrinkled, fissured or smooth. May appear raised, corrugated, verrucous flakes. Now microscopy: hyperkeratosis, acanthosis, squamous hyperplasia, squamous cell hyperplasia is called acanthosis. This is squamous cells hyperplasia means proliferation or increased cells numbers or size. Orderly mucosal epithelium and dysplastic changes you can see sometimes merging into carcinoma in situ, like carcinoma in situ. This basement membrane is intact in this case. Inflammatory infiltrate of lymphocytes, macrophages. You can see these leukocytes. Vascular dilatation. Now erythroplakia, a red velvety possibly eroded area within the oral cavity. You can see red velvety possibly eroded area usually remains in level with or may be slightly depressed in relation to surrounding mucosa. You can see this is elevated part and this erythroplakia may be slightly depressed. Histologically, superficial erosions with dysplasia, carcinoma in situ or already developed carcinoma in surrounding margins. You can see here the carcinoma may developed in surrounding margins or carcinoma in situ. Subepithelial inflammatory infiltration. That means you can see different types of inflammatory cells like neutrophils, monocytes, macrophages, lymphocytes. Third one, speckled leukoerythroplakia. You can see leuko and erythro, that means white and red. You can see here white and here red. White and red. Characteristics of both leukoplakia and erythroplakia.